tātou, you're listening to Hine Ki Te Wheiao, a space where we hold kōrero that matter, stories of strength, learning, struggle and healing. In this, we centre the voices of wāhine Māori and explore maternal mental health through a lens grounded in mātauranga Māori and lived experience. In this episode, we have Khyla Rūpapera sharing her experience in nursing, providing advice in healthcare and why she made the jump from clinical spaces to wānanga Māori.
Kia ora!
Kia ora!
Mate! I'm actually so happy to have you here. Oi, honest, everyone's going to be watching like, how do you two know each other? Because for the past 3 guests that we've had on, I obviously know all of you, so maybe we'll get to yarning about who you are. But firstly, I wanted to say thank you. Thank you for jumping on our podcast today and bringing your pukenga down from up north. Thank you for travelling down to Tāmaki so we can yarn about the health system and all of these cool stuff that wahine Māori face. Let us know, ko wai koe, no hea koe.
My name is Khyla Rūpapera. I'm from Ngāti Kahu and Ngāpuhi, specifically Te Whānau Moana and Te Kapotai.
Tweets.
I'm an enrolled nurse, not a current practicing enrolled nurse, but I do have my tohu, and I'm currently a registered nursing student.
Beautiful. What does that, like, I'm dumb. You talk to me like I'm dumb. I don't know what the registered thing means.
No, honestly, it's actually so common. People are like, what's the difference? Enrolled nursing, it's only an 18-month course, so it's a diploma. Registered nursing is 3 years, so that's a degree.
Right.
So not as much knowledge or skills in enrolled nursing.
Okay. So from like a Western perspective, if you were to do so can an enrolled nurse, someone who gets their diploma, can they go and work in hospitals? Is it like the same type of mahi?
Yeah, same mahi. There's just different areas of care. Like I can't do pediatrics or I have to do specific training if I want to get into like a mental health institution. Yeah, it's kind of changes all the time. The government's been changing the nursing standards and guidelines a lot lately.
Yeah.
But good and bad things.
Like how? What have they been shifting? I'm aware that the government have been changing a lot of things. Especially when it comes to Māori, and it has quite a big effect on Māori. But what have they been changing specifically, if you're aware of it, within like the nursing world?
Well, the main one, they recently changed, I think it was beginning of this year, they changed the nursing competencies. So every 2-3 years, nurses have to do professional development or a certain amount of hours of the professional development to ensure that they're still upskilling and keeping that knowledge maintained. But the competencies changed from pretty much a Western medical worldview to including te ao Māori or Māori kupu, like rangatiratanga and leadership is one of them, whanaungatanga, manaakitanga, pukengatanga, stuff like that, whereas it was just all completely in English. So they're kind of trying to incorporate te ao Māori's worldview.
Okay.
But it's like the minimum, kind of.
Bare minimum.
But it's a change, it's a start.
That's good. It's positive. It's a step in the right direction. I've been seeing that quite a lot, actually, with all the nurses that I've had. Well, I won't say I've had many, but the one that I go to with my whānau now, whanaungatanga is a huge thing, that nurses
miss out on.
Yeah. And it's something that I find that we, as like just the whānau who are walking in to get checked, we almost need it to be established to form that trust.
Exactly. And that's why I think one of the main things about them changing the competencies is knowing what to expect or include in your services or your care when you look after whānau, not just the one person, but inclusivity.
The pāhara kike.
Looking at the whole whānau, not just the person and ticking off boxes.
Yeah.
I love that. I love that. So you're a registered nurse, but you're not practicing at the moment?
Enrolled nurse, but I'm studying to be a registered nurse.
Okay.
Sorry.
Let me go back. You're an enrolled nurse studying to be a registered nurse. What made you decide, okay, yeah, I'm going to go and learn a bit more. I'm going to pull away from... Actually, maybe we'll start there. How was your experience as a nurse?
Being young, it had its challenges because where I was working, I was the youngest nurse by far, I think by like 10, 12 years or something. And being that young on the nursing team, I feel like people don't really expect much from you, or they don't include your thoughts or ideas seriously, or feel like you can't contribute to the hui in the way that they want you to, if that makes sense.
Yeah. So they judge you?
Pretty much, yeah. Not all of them, just a few of them. But slowly, after taking on a serious role last year when I was practicing, they started to see like, oh, you know, she actually can do the mahi. She does what she needs to do. Not boasting myself up or anything funny.
Get it.
But yeah, they slowly started to trust me to carry out things without them, you know, hovering over my shoulder and stuff.
Okay. So it was about like upskilling, I guess.
So wanting to be taken seriously, and because when I first started nursing, I originally wanted to be a pediatric nurse, and because you have to be a registered nurse to do that.
Yeah, okay.
It's like, yep, give me the babies.
I love that. Okay, so yeah, I think you've just answered my question, because I'm sitting here going, what's a pediatric nurse?
Oh, yeah. So it's working with babies like Starship.
Okay. Oh, I love that. So that's where you eventually want to end up.
When I'm mentally strong enough, yes.
Yeah.
I think that's part of the reason why I started with enrolled nursing, just to get a feel if I actually did want to do this for a long term, or whether it was just something, you know, like a diploma to please my parents, like, oh, look, I've got a qualification.
Yeah.
Love me. No, they do love me. They love me very much.
Respect me. No,
Yeah,
jokes.
be proud of me.
I love that. Wait, so pediatric nurse, you want to end up working with babies, but I just want to touch on something you just said. You said when my mental well-being is well enough.
When I'm mentally capable to care for pepe in such a vulnerable state, and whānau as well, like especially the mums. I'm not a mama, but I just can't imagine how frustrating it is to spend weeks in Starship with your pepe who, I don't know. And it seems like some nurses don't care, or they're just like, oh, well, it is what it is. And I'm like, no, do something. No.
Yeah, I love that. I love that you've recognised it within yourself, and you've recognised that that's actually he tapu te pepe. Like this is a tapu mahi, you can't just go in, like rush in. I think that's wicked. But I guess my partai is like, because you have recognised that and now you're going back into study, you did mention to me around the types of wānanga that you're now getting involved in. Like what does these two worlds look like? Like what's the difference between where you were and where you are now?
Just how much my program embodies the Te Ao Māori worldview compared to where I was. Do you mean like my previous studies?
Yeah.
Yeah, I was studying, so when I was first studying for enrolled nursing, it was down the line in Invercargill, and they're just real, Western way of thinking, go by the book, has to be the government's guidelines. You can't go out
Stay in
just
the
no
box.
holistic approaches, pretty much. It's all scientific facts.
Yeah.
But in my program that I'm doing now, it's mostly holistic care and how we can balance both the Western worldview and Te Ao Māori worldview, and just working with those together rather than, like with my previous studies, just straight scientific Western medicine. And in our wānanga, we have one every 3 months, so 4 per year. Next month we've actually got our wānanga in Whangarei at North Tech Marae. But it involves bringing in guest speakers who, they could be nurses, midwives, doctors, anything to do with health professions. And they just talk about what they've experienced or seen from other people in their practices, like you're saying, the judgment, the stigma around caring for Māori or Pacifica. It's just inclusivity, pretty much. It's honestly so cool. I'm so glad that I joined the program. It's just what I wanted it to be and everything more.
I love that. I love that. And I feel like there needs to be more types of solutions for Māori that work within health that allow us to actually like ruku back into our own whakapapa and our own selves to ground ourselves. Because I heard this kōrero from a lady that actually just walked out the door, Cindy Kawana. She said, you can't fill other people's cups if your cup is empty. And that's something that I've been sitting with. It's quite like, I feel like as wahine Māori, we are constantly giving. Oi.
I knew that's what you were going to say.
Like just all the time we're constantly giving and it gets draining. It gets draining, but also it's like this, for me personally, there's this switch that I like just can't turn off. Like if you were to ask me, hey, can you do this for me? I'll be like, yeah, all good. Got you.
But you could be completely drained.
But I'm tired, you know, I haven't slept yet. So yeah, I guess what are your ways where that help you navigate that, like the whole empty cup? How do you fill back into your own cup?
Knowing why I took on nursing, that's my main reason that grounds me. But also knowing that our hapori need it, because there's a lot of areas up where I used to work, like rural areas, that they had like the bare minimum healthcare services provided for them, or they'd have to wait like 4 weeks for a doctor's appointment for something little. Yeah, like just knowing that there's a need and that I can actually do something about it. That's what kind of just keeps me going. Don't get me wrong though. Some days I'm like, nah, I can't do it today. Like, I've been empty for 2 weeks now. Someone else take a turn, but that's my main reason.
That must be so hard, eh? Like you were just talking about. That's crazy. The 4-week turnaround is crazy. I'm not going to lie, I'm pretty privileged hearing that because my turnaround to see a doctor is probably about 2 hours.
Wow.
At max. But I know I sound like a privileged little egg.
No, but that's how it should be though.
I mean, it's like when I think about it, why do you think our rural communities aren't being resourced as well as places like Tamaki? Like, is it like a numbers thing? Is it because there aren't many people there? Is it
I think it might be funding, just funding and judgment. Like, I'm not gonna lie, I've had a few cases where I've seen a whānau, I think it was maybe 4 or 5 times for the same reason. And every time I went back, they'd just forget what I had told them. Like, you know, if you get these signs for whatever, it might be this or that, or this is how you take care of it. Just trying to give them somewhat health literacy. But it's the motivation sometimes in our whānau to actually do something. But yeah, funding, motivation, and money, because you don't get paid good money in rural areas. That's why a lot of people or nurses end up leaving their jobs. Like, there's a bunch of stuff. Nurses wanting to be paid what they think they're worth. Funding, or health literacy.
That's so fair. Like when I look at under-resourced and understaffed GPs, like whether you're a local GP or whether you're like a hospital, my whole thing is like, we shouldn't be having to leave. You shouldn't be having to leave your own rural town to move to a place like,
tamaki. That's just an example. I know that even anywhere in New Zealand, nurses aren't paid what they should be paid. And it's quite hard to try and influence that system change from the ground up. Like, because all of our nurses are front-facing kaimahi and they're with our community, they're doing the hard yards every day, but then there are people down in a building in Wellington who are actually deciding how much money you make. I guess, like, if you were to see a perfect picture of what nursing could look like, let's say you're in this wānanga with whaiamoi. After you graduate, you come out with all this incredible pukenga that you probably already had, but maybe you're just tapping back into. And then you step back into becoming a registered nurse. What does an incredible tomorrow look like?
Encouraging and displaying Māori health models, like in
Yes.
GP services, hospitals, pharmacies, just so people, if they're willing to, can understand it's not just a physical aspect when it comes to health.
Yeah.
Like the what is it? Te whare tapawha.
Yeah.
Like incorporating all those aspects, because sometimes it isn't, or sometimes it's like an emotional thing that can cause your physical, I don't know, injuries but yeah, just really getting people to understand that the whole aspect of
Yeah.
a person,
That it's more than just physical. That there's,
not just scientific shit.
Yeah. That's a really good reminder, actually, to all of us to, like, talk about things,
Yeah.
get it off our chest.
Reviewing healthcare professionals' knowledge on inclusivity, worldviews, and te tiriti o waitangi.
So what would that look like, though, to review health workers' knowledge? What would it look like?
That's where the competencies come in, the new nursing ones,
Yeah.
and how they've included, Māori aspects now into our professional development.
Like, I do think that's necessary that all whānau, whether you work in health, social services, especially those two, though, health,
Yeah.
social services and justice, there needs to be more action around te tiriti, like te tiriti-based approaches. I see it in everyone's policies. We value te tiriti, we will uphold te tiriti, and it's like, no, you don't.
Yeah. You're not practicing what you preach.
Yeah, where? Yeah, anyway, agree.
Well, we talked about before, whānau involvement and participation. So educating whānau on how to care for members at home after they've sent home from the hospital.
Yeah.
Because I had a lot of kaumātua kuia that would go home with all these pills, like new pills after surgery or big health complication, and they don't even know what they're taking, or they don't know what it's for. Yeah, and like their children would be like, oh, I don't know, I just know that they have to take it at this time, every like 3 times a day, blah, blah, blah.
Yeah.
And you'd actually be surprised when you're having a kōrero with one of your patients and you explain to them what their meds are, what they're for, and how they help.
Yeah.
Because it kind of motivates them or gets them to actually want to take their pills.
Yeah.
Not that I'm encouraging pills. Sometimes a lot of the time actually, I offer or I give advice on rongoa
Yeah.
practices, again, to be inclusive of that te ao Māori worldview.
Yeah.
But yeah, it's just people not knowing,
Not trusting.
not being educated
Yeah.
by doctors, because, it's just quick, do what you're here for, out.
But I've noticed it must be really hard for you guys, because how you were saying that there's a 4 day, did you say 4 day waiting?
It was 4 weeks.
4 weeks.
Yeah, it was 4 weeks. I think it's much better now. I don't know how or why, but it was really bad. Was it beginning of this year, end of last year?
Yeah.
Yeah,
Okay.
just the waiting for an appointment was crazy.
It was bad. I'm just wondering though, because if whānau, you know how you were saying like the doctors and the nurses, when they give are they prescriptions? Is that the word? Prescription? When they give them and then they're like, oh, these are the pills you take, go. Like go home. I wonder if
if there is capacity, what we need to do is, from a systems level, to ensure that there's capacity for our doctors and our nurses to break it down for our whānau. You know, because I've seen, not going to lie, I'm really grateful for all the doctors and nurses I've ever had, but I have had that quite a lot. Here's your pills, have a good day.
Yeah.
And I blindly trust them because I know that you're an expert, so I'm going to listen to you. I'll do it, but I don't know what I'm actually taking.
Yeah.
I just know it helps me somehow. So it's like, I wonder what that would look like if there was capacity for our health workers to educate.
Stop overbooking appointments.
You reckon?
Like, be for real. Like, how are you going to give like high standard care to whānau when you've got a 15-minute slot for something that could easily take an hour?
Yeah.
Yeah, it's just overbooking, but that's kind of hard because, you know, there's so many people that need to be seen, and it's like, well, we can only give you 15 minutes, but I haven't thought of a solution on that one, to be honest.
But it's hard, and it shouldn't actually be up to you. It shouldn't be up to the ground workers to think of the solutions. It should be up to the people in power to think of them, because at the end of the day, they're making about 4 times what nurses make for sitting at a table to make decisions that don't actually benefit you at all. So it's like, I've seen a lot of reports, like evidence-based reports, that have tried to tell decision makers and policy makers, like, hey, we're struggling.
Yeah.
You're not helping. Please listen to whatever evidence they've collected that would inform a better working environment for whānau. And it's not listened to at all. That advice is just swept under the rug.
And it's like, why?
Yeah. Why am I here?
Yeah, why do I even bother with these reports if you're not going to try help us out or listen, but they still expect the reports. And it's like,
but you have to do it or
Yeah.
you'll lose your job.
right? Like,
But I was just wondering if there's anything that you could say to the people that do make the decisions, that do decide how much you get paid. What would you say to them? Fuck you. No,
yeah, fuck you
Get
guys.
fucked.
No. And give me a raise. No.
period.
I'd probably say listen to the people who actually do the mahi. You're not going to get any better advice or recommendations other than those who are at the front line providing that healthcare. And be nice.
Irakate. Period. Be nice. I love that.
Oh, yeah. Accessible and affordable care.
Yeah.
So I don't know if you've seen, but there's recently, like in the last year or two, been quite a few GoFundMe pages from Māori whānau specifically. But this is for like cancer patients who have just like been told, you know, you've got one of the rarest forms of cancer and it's $100K for your treatment, blah, blah, blah. First of all, why is it $100K? Like,
Bro!
who has the money in this economy to spend $100K on treatment?
On healing your body?
Yeah, like, it makes me sad when I see those, and just because being a person who doesn't like to ask people for money or like anything in general, I can only imagine how hard that must be, one, to make a page and say, oh, like, you know, we don't want to ask you guys, but if you can, like, donate $5 because our son needs 85 more K to get this, otherwise he'll die within 3 months. And it's like, wow, it shouldn't even be that much.
If it costs like $100K to cure a specific type of cancer, what I would like to see is more preventative measures put in place for cancer.
Yeah.
Like for those big beasts. Like my mum died because of cancer. My dad died because of a specific type of cancer. So it's quite a big beast, and it's kind of like our whānau had to go, okay, what do we need to do to make sure we don't get that by that certain age? But there's not actually enough information out there.
Again, that health literacy, people not actually knowing.
Yeah. But why? Like, why is it like that? Is it a capitalism thing? Is it like, we're not going to tell you how to heal yourself because we make more money in the hospitals? Like, or am I just being a conspiracy theorist? What's going on?
I don't know. I think they kind of expect people to know, which is really weird.
Yeah.
Like, it's not common knowledge to know, like, oh, you know, I may have that genetic and I might need the testing or blah, blah, blah. Yeah, it's just not, people don't know.
People don't know. I guess maybe that's a question that, and perhaps I'm being like selfish in asking this question, but is there a way to prevent measures like cancer?
Yeah, there's heaps of different ways, like physically being fit or eating right. Those are always the main ones that they'll tell you. I think it mostly comes down to genetics. But wait, have you been tested?
No.
What kind of cancer did your mum have?
Breast cancer.
Breast cancer. How old are you?
27.
Have you ever had a breast screen?
I'm
Well,
like...
No, but they'll normally tell you like, oh no, you're too young anyways.
Yeah.
Because I had my old co-worker, he had a really close family friend who died, I think she was 23, of breast cancer because her mum and her nana had breast cancer.
Holy.
Yeah, so she was scared. She was like, oh, you know, they've both died of breast cancer. I think I need to get checked. And being the breast clinic, they always backed up somehow. But they were like, oh, no, you don't need to worry until you're like 30, 35. That's when they kind of start to take it seriously.
Okay.
But if you're under that age, it's like, nah, you're too young. Don't even worry about it.
Yeah.
Not trying to scare you.
So
Yes,
this
but
podcast's
go get
over.
out there.
So thanks for coming.
Thank you for having me.
Okay.
Yeah, but that's
good.
that's like 1 in a million.
That's
probably.
good to know, though. It is educational, and I feel like sometimes our whānau Māori, we take our health for granted. We take our bodies for granted. I can't lie. I quit vaping, by the way.
Good on you. I didn't.
Me and Nico, we stopped. And that was a decision that he kind of led. He was like, okay, we need to stop for our babies' sakes.
Yeah.
Like, because they would always watch us walking outside, and also just our own hauora.
Yeah.
So we're starting to take our hauora a bit more seriously. But that's good to know too. Like any educational things that maybe whānau Māori aren't aware of. Actually, is there anything that you feel like, do you have any gems that maybe our whānau Māori that are listening and they're like, oh, I didn't know that's a thing?
There is a thing called Health and Disability Commissioners, and they are who created the Code of Rights. So there are patient rights that you have when you access any healthcare service, and it's just letting you know what or how you're meant to be treated, or what you should expect or receive when dealing with health professionals.
Okay.
Do you know about
No.
the rights? Yeah, see, not many people know about the rights. So I've actually told a lot of my patients and my own whānau members, like, write a complaint, because that is, like, they're not allowed to do that. I think the first one is to be treated with respect. But yeah, it's like, right 1, to be treated with respect. Right 2, the right to fair treatment. Right 3, the right to dignity and independence. There's heaps of it. I think there's about 10 rights. Yeah. But just knowing your rights helps heaps. I feel like it'll help whānau members be advocates for their own whānau when receiving healthcare.
Oh, yeah, I love that. I actually love how you just straight mic drop.
Yeah, and that's our podcast.
Yeah. And thanks for coming. No, I really appreciate it, though. We are at time right now. But on behalf of Hine Ki Te Wheiao, thank you for coming through.
Oh, thank you for having me.
If you like this episode, you can follow us on Instagram and Facebook at Hine Ki Te Wheiao.